Okay, so we're actually trying to look at another very important aspect of history taking and physical examination in gynecology and obstetrics. And this is dating of pregnancy, right? Dating of pregnancy. Okay. So in dating of pregnancy is just simple. You are trying to know when this pregnancy actually came in. Then you are trying to also know when is a possible date that a woman will deliver. Do you understand? So in dating of pregnancy, you're actually trying to look at two aspects of it. So you are doing this just to determine the gestational age and also estimate the possible time that the woman will give birth. Okay, so you can use the manual way, you can actually use ultrasound, which is much more accurate, but you always learn the manual way because you don't want students to not learn the skills. You understand? So it's actually one of the most critical steps in obstetric history taking and examination. It guides prenatal care, timing of investigations, and delivery planning. Do you understand? So for history-based pregnancy dating, you use the last menstrual period. Okay. Now you ask the woman for the last time she saw her menses. Okay. That's the first day of the last menstrual period. Okay. You add 7 days to it. You minus 3 months from it. You add 1 year. Do you understand? I've actually spoken about the Nagel's rule. So if there's anybody who needs proper explanation on this, you can just comment and I'll get to you. So cycle irregularity. If cycles are irregular, you can't depend on last menstrual period. So if you're using this rule, just make sure that the woman has a regular 28-day cycle for menstruation. Ask if they have been using any contraceptive. Ask if she has been bleeding so much. Ask if she has ever had any fertility treatment. So symptoms timeline. Okay. You try to also ask when they actually started having, when they started vomiting. Ask when the breast started becoming tender. Ask when they started feeling like the baby is moving. Okay. Then previous ultrasound date. So early ultrasound are more accurate. Do you understand? So you also pick up the ultrasound. Okay. So you don't really depend on the Nagel's rule, but Nagel's rule is something that is very, very good to know. So if the pregnancy is after 20 weeks, that's where you can now measure the stomach of the mother from the pubic symphysis down to the zaphestinum. Sorry, no, that's a linear nigra. So for this one, you first of all palpate. When you feel the height of the fundus, you measure from the pubic symphysis right towards the fundus of the uterus. So Leopold's maneuvers, this is when you now try to check around the stomach, see how the baby is lying, see which part of the baby is actually pointing down to the cervix. Do you understand? So you also pick up for fetal heart tones, that's a heartbeat. Then clinical integration. So you combine history taking, physical examination, and ultrasound findings. Do you understand? So that I can get the most accurate gestational age and also estimate accurately the possible time that this woman will give birth.